Well, good morning, everyone. Thank you for coming. I certainly do appreciate your interest in this very important topic. I am pleased to present an overview of the second annual report on the well-being of seniors in Newfoundland and Labrador. The Seniors Report 2025, Monitoring Key Indicators of Seniors' Well-being in Newfoundland and Labrador, is now in Volume 2, which I will refer to throughout this presentation as the Seniors Report 2025 for short. This report compiles data and information from many reputable information sources, including Statistics Canada, Government of Newfoundland and Labrador, and the Canadian Centre for Health Information, CIHI. The primary purpose of this report is to annually inform on how Newfoundland and Labrador seniors are currently doing on 6 key indicators of well-being: individual health, health care, finances, housing, transportation, and safety and protection. We use these annual reports of well-being to monitor the trends in these 6 areas over time. Last year's report was our baseline year, so it's a little too early to perform any in-depth trend analysis. However, we have offered throughout the report comments on some of the changes from previous years, as well as noted areas where there appears to be progress or regression. Addressing trends over time ensures that we can say with confidence where seniors' well-being is improving and where it is not. This informs our advocacy work as an office and enables us to make well-informed recommendations to improve programs and services for the seniors of Newfoundland and Labrador. We make this report and its companion document, which details all of the data tables, publicly available to ensure transparency, but also to provide seniors, community organizations, service providers, and policymakers with the powerful data to inform their programs and services and their research and policy development. And I do know that our last year's report was used by many groups. Indicators and data are presented for the most recent year available. In most cases, it will be 2024. And a 5-year comparison is also provided when possible. Further, we compare the Newfoundland and Labrador data to that of Canada and other provinces and territories where it's possible. I will begin the presentation by outlining the demographic trends and some of the positive findings. Then I will focus in on the well-being of seniors from the perspective of where they live: seniors who live in community, seniors transitioning into the care system, and seniors who live in congregate living facilities. In 2024, the proportion of Newfoundland and Labrador seniors aged 65 and older was 25%, with a 4.9% of people age 80 and older. And while the greatest majority of seniors live in the eastern zones, the Avalon Peninsula, the proportion of seniors in eastern rural, central, and western zones is in the 30% range already. With a minimum growth projection in fewer than 10 years, the number of seniors will increase to 28% of our population, and people aged 80 and over are expected to increase by 64% to over 44,000 seniors in this province. In effect, this means that 8% of Newfoundland and Labrador's population will be 80 years and older. This changing composition with growing numbers of older seniors is important to recognize and monitor, because it will have implications for the types of programs and the volumes of programs and services required to meet their needs, which will be different than younger seniors. Statistics Canada survey data found So these are the positive changes now, findings that we had in the report. Statistics Canada survey data found that NL seniors reported higher positive feelings of satisfaction with their lives and a stronger sense of connection to community than the Canadian average. This is good news. The proportion of seniors living in the community is 95%. And according to the 2021 census data, about 75% of seniors 85 plus still live in the community. In 2024, 89% of seniors had an active driver's license, which is very good news, because in our province, where we have so little in the way of public transportation, a driver's license is critical to your well-being and access to services. CIHI data on the new long-term care residents who potentially could have been cared for at home is an indicator which tracks Basically, if newly admitted long-term care residents could have, with the right clinical services and supports, been provided services to remain at home. The indicator kind of sheds a light on potentially unnecessary institutionalization. At 7% in Newfoundland and Labrador, we have one of the lowest rates of new residents entering long-term care who could have potentially been cared for in their homes. The Canadian percent is 9.7, which I think is a good news story, and I think it's very indicative of the care that people are providing to their loved ones in this province. Finally, data from Newfoundland and Labrador Housing Corporation shows that the combined number of seniors on a wait list for units and rental assistance decreased by 23% in the last year. It is important to note, however, that we have not seen a similar decrease in recent years. This was a one-year data point. So while it may be a good news story, it is something that we as an office will continue to monitor. Now, that was the good news. From this point on, basically, all of our findings have not been positive. We'll start with seniors living in the community. Seniors living on low fixed incomes feel the impacts of the cost of living harder than most and have the least opportunity to really supplement their incomes in any other way. In 2023, the median income for Newfoundland and Labrador seniors was $29,710. This is the lowest of all Canadian provinces and territories. And keep in mind that this is only 50% mark. That means that half of the seniors in this province have an income less than $29,710. Low income is an eligibility requirement to receive the Guaranteed Income Supplement, or GIS. And while uptake for GIS has decreased by 3% in the last 5 years, it is concerning that seniors in this province have the highest dependency on GIS in Canada, and even higher than any of the other Atlantic provinces, who only range from 32 to 38%. Employment participation rate for seniors aged 65 to 69 years has increased by 12% in the last 5 years. This rate is much higher than the national rate of 2%, and while it may be a positive indicator, people having more active lifestyles, the labor market opportunities being better for seniors, it could also be a consequence of the high cost of living. And this is an area that we need to do more research. 13% of seniors are moderately or severely food insecure, which means they must compromise on the quality or quantity of food, or in severe cases, that they must reduce food intake, which could include going without food. Research tells us that the main cause of food insecurity is insufficient income, which I just explained to you. Even more concerning is that this rate has increased by 5% just since last year for seniors. Associated with this, it's not surprising that fruit and vegetable intake has decreased by 6% over the last 7 years. It's very expensive to buy for healthy food. 31% of Newfoundland and Labrador seniors reported getting the recommended amount of physical activity, which is 10% lower than the national average. Yet despite this, 50% reported that they perceived their health to be very good or excellent. We'll continue on with seniors living in the community. Newfoundland and Labrador Housing offers programs to assist homeowners with repairs or modifications. Monitoring the number of seniors engaging with these programs can help identify if there are barriers to accessing these services. In 5 years, the number of home modification applications increased by 205%, and the number of home repair applications decreased by 28%. Now, according to Newfoundland and Labrador Housing, the home repair program has an acceptance rate of around 72%. So this is an area that requires analysis to determine why are there a lower number or decreasing number of applications. Could it be that the cost requirements on seniors are just too much for them to be able to do? Or is it that the policy requirements are too burdensome for the seniors to be able to meet, and so they're just not applying any longer? We know the housing stock for these seniors is getting older, so no doubt their homes need repairs, and they're struggling to do them. The rates of senior shelter is nothing short of startling from my perspective. 21% of people using emergency shelters are age 55 plus. We can't get the 65 plus number. Further, the fact that 9% of people experiencing homelessness reported experiencing homelessness for the first time after turning 55, well, that's just alarming, to be frank. Because the Canadian research has found that entering first-time homelessness as a senior is directly correlated with a shortened lifespan. We need to be concerned about homelessness for seniors. Crimes against seniors encompass, and I should add there that this is an area that my office has prioritized and we are actually reviewing. Crimes against seniors encompass various offenses that take advantage of vulnerabilities. A 64% increase in violations against seniors in the last 5 years is concerning. I've heard from many seniors, especially in rural Newfoundland and Labrador, about their concern for their safety. Our office has raised this issue to the Department of Justice and Public Safety through their review of policing services. We've highlighted the need for improved community policing resources, especially in rural Newfoundland and Labrador. It is somewhat surprising that 50% of seniors perceive their health so well, yet 88% of seniors have one chronic condition, healthcare condition, and 45% of seniors live with 3 or more chronic health conditions. Adult day programs can offer a break for caregivers, provide social and recreational activities, care and personal support to the attendee, and support a person's ability to continue to reside in the community. In the entire province, there are only 2 adult day programs, and they are both located in St. John's. Given the demographics of this province, the increasing number of people with dementia, and the increase in the number of people with dementia that will come with the increased number of people 80 plus, we are concerned about the absence of facilities for adult care outside of the St. John's area. And we'll conclude this in our ongoing review of community supports to seniors. It goes without saying that health care plays a significant role in our ability to age well. Access to quality health care along the continuum from independent living to residential care is essential. Yet, in this province, the number of seniors with access to a primary health care provider decreased from 92% in 2021 to 84%. The gap between the Newfoundland and Labrador percentage and the Canadian percentage was only 2% in 2022. And this has widened to 8%. So we are, as a province, our seniors are getting less access to health care, to a primary health care provider than the Canadian average, and that gap is continuing to widen in comparison to Canada. In the last year, the rate of hospitalization per 1,000 seniors increased by 1.6%, and the rate of emergency visits per 1,000 seniors increased by 2.4%, more than double the Canadian rate. Further, the regional differences are substantial, with more rural zones having even higher rates. So essentially what this means is that emergency visits, seniors' visits to the emergency rooms increased by 24 visits for every 1,000 seniors. Now that's not, there were 24, that is increased by 24. And that the rate of hospitalization for every 1,000 seniors increased by 8. So we are seeing an increase in the amount of visits to emergency rooms in the absence of a healthcare provider, primary healthcare provider, and we are seeing an increase in the number of seniors who are being hospitalized. Benchmarks are goals based on scientific evidence that set the amount of time that is deemed appropriate for people to wait for a particular healthcare service. CIHI reports the percentage of cases meeting the national benchmark wait times for several procedures. And while this information is not specific to seniors, most people undergoing the particular surgeries we're talking about are seniors. The most common age group for a hip replacement was 75 years and older, and the most common age group for knee replacement was 65 years to 74 years. The benchmark for knee and hip surgery is 182 days. The benchmark for cataract surgery is 112 days. In this province, knee surgery only met the benchmark timeframe in 37% of cases, hip surgery only met the benchmark in 48% of cases, and cataract in 43% of cases. And we'll just dig into that a little bit different. Let's have a closer look. Related specifically to hip and knee surgeries, which are critical to seniors' continued mobility and their ability to age well in the community. And of course, it's a use it or lose it issue, right? If we're laid up for any amount of time, the older we get, the less likely we are to get back on our feet to the same degree we had previously been. You can see that in the dark blue, the number of completed hip surgeries started to increase around 2023-24. However, the demand for hip surgery has been increasing since 2021-22, such that the wait list is significantly higher per year than the surgeries completed. It is a similar situation with knee surgery. However, the wait list is growing at even a greater rate for knee surgery. Now, this really concerns me because mobility is critical to well-being. And I've already heard from numerous seniors in numerous communities that they've been told by their healthcare provider that their age is such that they are not being considered for treatment and surgery. I wonder if this is the reason. When a person is medically discharged from hospital, but remains there awaiting living or care arrangements, they are described as an alternate level of care. ALC is the term we've all come to know. High rates of ALC can mean fewer beds are available to people needing acute care. Less efficient healthcare system could also be a consequence of ALC beds. It also means that seniors are living in inappropriate arrangements that they are paying for, by the way, because they're discharged from hospital, without the support they require to maintain functioning. Hence, they are getting more frail more quickly. And I've spoken to many health professionals working in long-term care who have told me that the care needs of seniors entering long-term care these days is significantly higher than it ever was. During the last fiscal year, 3,258 seniors spent time in ALC, and this has continued to increase by 17% over the last 4 years. 14% of all seniors who are hospitalized get designated ALC. In fact, it accounted for 33% of their time spent in hospital. 1/3 of their time that they could have been in community or in any other living arrangement where they needed, getting the supports and services they require. But when you're ALC, you're not getting that same level of service. You're not getting physio. You're paying for your medications. It's significant. The average length of stay in ALC was 30 days, but it is worth noting that there were significant differences across the zones. For example, the average length of stay ranged from 16 days in Eastern Rural to 46 days in Western. 24% of seniors in ALC were discharged home with support and 28% to long-term care. Therefore, it can be assumed that the time spent in ALC is waiting for these services and resources to be secured. So let's talk about seniors in personal care homes. Personal care homes are residential facilities for seniors and adults who need assistance with activities of daily living but don't need around-the-clock medical services. These homes are privately owned and operated. In 2019, the number of beds since 2019, the number of beds has increased 13%. However, during that same period, the wait list has increased by 78%. We are clearly not meeting the demand. Further, if you were to look at where the homes are located versus where the demand is, that's a significant issue. The homes are not where there needs to be an address of where the needs are and where actually the homes and consequently the beds are. Long-term care for seniors is the next piece. Long-term wait lists for long-term care placement has been an issue facing Canadian seniors for decades. In this province, the number of long-term care beds per 1,000 seniors is 25. There are only 3 provinces or territories where the number of beds per 1,000 seniors is lower than 25, and 2 of them are in the 24-25 range. Further, the distribution is not equal, which means more seniors in some rural zones where proportionately there are more seniors are waiting longer in hospital for long-term care placement. Since 2019, the number of beds has increased 12%. However, during that same period, the wait list has increased by 37%. Yet last year, when we look at the occupancy rate, it was 92%, meaning there was an 8% vacancy factor. And while I'm not advocating for more long-term care beds, until we address the needs in the community and the supports and services that seniors need in the community, this is going to be our reality. And are we going to continue to allow seniors to remain longer in ALC, or are we going to address these needs? The quality of care in long-term care. The impact of health care services and supports on our ability to age well is critical. And it's determined by the quality of care that we receive. CIHI reports on quality of care in long-term care. These indicators are not specifically reported for seniors alone. However, the majority of people in long-term care are seniors. As you can see, there are 6 indicators of physical and mental well-being in long-term care. Newfoundland and Labrador is doing better on 3 and worse in 3. There has been little change in these indicators over the last 5 years. And while I am concerned about the fact that Newfoundland and Labrador long-term care residents experience pain, physical restraint, and potentially inappropriate use of antipsychotics more than the Canadian average, I'd like to focus in on 2 of these specifically. The frequent use of restraints. The use of restraints is an indicator of potentially poor care because repeated use can lower the senior's ability to perform activities of daily living, lower their cognitive ability, increase bed sores, incontinence, and many other conditions. During 2023-2024, physical restraint use in the province's long-term care facilities was 12% compared with the national average of 5%. And this was the same rate last year. Perhaps even more concerning are the regional differences. Physical restraint use was the highest in Western Zone at 19%, followed by the Central Zone at 16%. This is concerning at the provincial level, even more concerning at these regional levels. And it's an area that needs to be reviewed and determined what is causing it and fix it. To focus in on the second area, the inappropriate use of antipsychotics. This refers to residents who are receiving antipsychotic medications without having a diagnosis to support it, and thus it can be used as an indicator for possible chemical restraint use. In 23-24, the potentially inappropriate use of antipsychotics in long-term care was 32% in Newfoundland and Labrador, higher than the national average of 25%. Quite concerning is the potentially inappropriate use of antipsychotics in Labrador-Grenfell Zone, where it is estimated at 45%. I will note that this is a 3% improvement in the Labrador-Grenfell Zone since last year, but it is still far too high. Further, every other region except Eastern Urban is on par or above the provincial rate. This is not good enough. In conclusion, the well-being of Newfoundland and Labrador seniors is not keeping up with other Canadian seniors. If I had to summarize the situation in Newfoundland and Labrador, I would say this. Newfoundland and Labrador has the oldest, poorest, and most unhealthy seniors in Canada, and in most cases have the lowest access to services, especially in rural Newfoundland and Labrador. So what does this mean? The needs of seniors for senior services and programs will increase, and the types of programs and services seniors need will change as the population ages. A focus on preventative community services is critical to ensuring that seniors maintain their health and well-being and can access services they require to age in the right place. Without these necessary, critical community supports and services, the demand for costly, unwanted institutional care is going to continue to increase. It's inevitable. So before I step away from the mic, I would like to say that the compilation of this report is no small task for an office of 5 people. And I just want to send a sincere thank you for all the hours spent in the effort of collecting and analyzing this data, preparing this comprehensive report. It would not have been possible without my small but mighty team, and specifically Ignacia Diaz, who is fabulous and was the lead on compiling and completing this report. I would also like to take the opportunity to thank the many people in government and community organizations that responded to our requests for information and our follow-up questions for clarification. Thank you.